Welcome everyone to the 2023 Wilma and Albert Musher Lecture. My name is Melissa Begg and I have the great honor of serving as Dean of the Columbia School of Social Work. It is fantastic to have this opportunity for faculty, students, and staff and alums and guests to come together virtually and hear from scholars whose work aligns with the mission and values of social work. The Musher Lecture was established in honor of Wilma and Albert Musher, who cared deeply about the development of scientific knowledge and technology for life betterment. The Musher Lecture was launched at least 4 years ago now, I think, as a platform for scholars to share their work on urgent social welfare problems that affect us all. It is one component of a broader Musher program that was established at CSSW in 1995 by Albert Musher in honor of his wife, Wilma. The Musher program continues Mr. Musher's legacy and promotes his abiding belief in the wise use of technology to improve the human condition. The program is grounded in his concept that well-being can best be improved through science and certainly through the practices and principles of social work. Most importantly, Albert Musher made a transformational gift to the school when he endowed the Wilma and Albert Musher Chair, currently held by Dr. Nabila El-Bassel, who, in addition to being the Musher Professor, is also a university professor at Columbia. The inaugural Musher Chair was Dr. Edward Mullen, who served in this role from 1995 until his retirement in 2010, and he is now Musher Professor Emeritus. I'm delighted to extend a warm welcome to Albert's nephew, David Musher, and his wife, Ruth, who I believe are joining us on this video today. Taken together, the Wilma and Albert Musher program supports a range of scholarly activities and resources at CSSW, including the Musher Chair, the Musher Lecture, and the Musher Doctoral Fellowship, all with an emphasis on the development, dissemination, and implementation of evidence-based interventions. Albert Musher's commitment to science and technology in social work was prescient, and we are immensely grateful. And now, for tonight's program, I'm so pleased that Dr. Victoria Frye will deliver tonight's lecture, Everything, Everywhere, All at Once, Modern HIV Prevention in the Multiverse. Dr. Frye, a distinguished professor of social work, recently joined our faculty here at Columbia School of Social Work and is co-director of the Social Intervention Group, one of our largest and most influential centers. She's also a member of the Columbia University Global Health Research Center of Central Asia, an international and interdisciplinary team of faculty, students, and service providers committed to advancing solutions to health and social issues in Central Asia through research, education, training, policy, and dissemination. With an impressive career spanning 2 decades, Dr. Frye has emerged as a trailblazer in the field of HIV prevention interventions, particularly among populations rendered vulnerable by social systems of oppression. Her dedication is evident in her extensive research, which is focused on diverse groups, including women who use drugs, gay men of color, and low-income heterosexual African-American cisgender men and women. Dr. Frye's scholarship aims to reduce social stratification by advancing the research base on multi-level drivers of health inequities, designing and testing multi-component and multi-level prevention interventions to eliminate health disparities, and by partnering with community organizations, members, and representatives to ground her work in equity. As a prolific author, Dr. Frye has contributed over 85 publications to noteworthy journals, demonstrating her commitment to advancing scientific knowledge and contributing to the academic discourse. Her dedication extends to serving on advisory boards like the HIV Intervention Science Training Program for underrepresented investigators. As a community member in Washington Heights since 1999, she's actively involved in local education, serving as an elected parent member of the District 6 Community Education Council. Dr. Frye holds her bachelor's in U.S. history from Columbia College. She earned her MPH in epidemiology and a DRPH in sociomedical sciences from Columbia University's Mailman School of Public Health. So this is an accomplished alum, and her return to Columbia signifies a homecoming and a continuation of her important and impactful journey in academia and research. Dr. Frye's remarkable career is characterized by her unwavering commitment to equity, to deep community engagement, and to pioneering research that addresses complex health disparities. Her contributions continue to shape the landscape of social work and public health, making her an invaluable addition to the Columbia School of Social Work faculty. So please join me in welcoming Dr. Frye. Victoria, it's a pleasure to turn it over to you.
Thank you. Thank you so much for that incredibly kind introduction. So thank you all for being here. Today I'm going to be talking about essentially the idea that we are now living in a multiverse, and that we need to adapt our HIV prevention intervention strategies to this new reality. But before we begin, I want to acknowledge my collaborators, as well as the participants who have engaged in the research that I'll be talking about. But I want to start with a land acknowledgement. And it's been brought to my attention that we do these land acknowledgements, and that's it. And it's superficial. So what I've done here is I've included a link, which is actually a fund that folks can donate to. And it's a rent fund. And it is managed entirely by members of the Mannahatta tribe. And so I encourage everyone to move beyond land acknowledgements and to donate. I also want to acknowledge all of the collaborators in the various research projects. They're more than I could ever begin to note, but here are some pictures of some of them. My colleague, Mr. Mark Page, who is hopefully somewhere online, is here with me at Columbia, and as are a number of other colleagues. In one of those, you can see Dr. Nabila El-Bassel, the wonderful team at Gersha, Dr. Brooke West, Dr. Leah Wilton from SUNY Binghamton, and many, many other collaborators. I also just want to very quickly do a positionality statement, and I recognize my position and privilege as a white, high-income, cis-hetero living, woman-identified, highly educated, and socialized to the upper and middle classes in the United States. And to note, my re-education and re-socialization is an ongoing project. So today, what I want to talk about are a few things. First, I want to talk about why I think everything must change. And it's not just me who thinks this. I'll be acknowledging a key sort of thought partner in this as well in a moment. Talk about some important background for understanding the HIV epidemic in the United States, as well as the watershed moments that have changed everything and the challenges we face because of this. And what does that mean for HIV prevention? What is it that we are doing, and what could we be doing? What are the promising approaches that exist? And then to recognize and to emphasize that other worlds are possible and simultaneous worlds are in existence. And some of us are existing in them, everything, everywhere, all at once. Okay, so to start, HIV in the USA, I can't tell you how many times in certain family get-togethers or elsewhere, people will actually ask me, oh, is HIV still a problem in the United States? Yes, HIV is absolutely still a problem in the United States. In 2021, we had over 32,000 new infections. And while we've seen a very small decline from 36,500 in 2017 to that number, 2021, that is not a very significant decline. And again, these are numbers, not rates. One of the things about HIV in the United States is that we have significant racial and social disparities. HIV is concentrated in the gay male population in the United States, as you can see here. And within that group and within the other groups as well, based on transmission category, we see significant racial disparities, with Black and African American people being most adversely affected consistently. And why is this? This is, again, you're social workers, you are knowledgeable individuals. You know that these disparities are driven by systems of oppression and privilege. They are intersecting systems that produce intersectional stigma and discrimination at multiple levels of the human ecology, that reduce access to all of the things we need to both prevent and treat HIV, starting with sex education, and moving to testing and so on and so forth. And if you, just to note, this talk is focused primarily on sexual activity as a route of transmission of HIV. And we don't need a reminder of white supremacy in the United States. However, the Kaiser Family Foundation just came out with a survey that really drives home how healthcare-based discrimination is a potent barrier to care seeking for people of color. And in a nationally representative survey of 6,000 adults, among those who had used healthcare in the past 3 years, 60% of Black or African American, 50% American Indian or Alaskan Native, and 50% of Hispanic, and again, this is the language from the survey, indicated that they actively prepare for possible insults and feel they have to be careful about their appearance to be treated fairly during a healthcare visit. So again, there's a plethora of evidence, data, papers, analyses that demonstrate that there is, racism is a medical mistrust, is well-founded, and medical racism exists in the United States. Similarly, with homophobia at a societal level, you may be surprised to learn that the United States is not doing much better, as compared to some other peer countries in terms of how many people agree with the statement, and this is a Pew survey, that homosexuality should be accepted by society. It has risen to about 72% in 2019 from 51% in 2002. But that is still not everybody. Similarly, I think it's really important to note that in the last several years, there's been a coordinated and violent movement to suppress the rights of LGBTQAI+ people living in the United States. And finally, HIV stigma. GLAAD just came out with their State of HIV Stigma in the United States report and found that, shockingly, just 43% of adults are comfortable interacting with people living with HIV in different situations. So everything about this must change because everything has changed. But those are just some very quick data points to help illustrate why we have these, we have concentration of HIV among certain populations and what we need to do, what is driving those concentrations. So in terms of HIV prevention, we've had some amazing transformative events and developments, technological innovations since the mid-2000s. Since then, we have become highly aware that HIV is often transmitted within partnerships, within primary partnerships. We learned that immediate start of antiretroviral therapy is associated with better clinical outcomes for individuals living with HIV, as well as contributes to reduced viral load within an individual such that they cannot transmit HIV to another individual, which then reduces what we call community level viral load. And that then is related to lower incidence at a geographic level. So one major approach to HIV prevention is ensuring that anyone who is living with HIV knows about their status and has the opportunity to start ART for their own clinical benefit, but also because it has a population level benefit. In 2012, we learned PrEP, which is pre-exposure HIV prophylaxis, was approved by the FDA. This was a complete game changer. PrEP is, as you might know, an HIV medication that can be taken daily as well as intermittently and now through injection that will prevent HIV. It has high levels of efficacy, extremely high levels of efficacy among gay men, and when it is taken consistently among heterosexual women, it confers significant protection. Also in 2012, we got HIV home or self-testing, so you can test yourself at home. And in 2016, we began a campaign, U equals U, which means undetectable, it equals untransmittable. So everything changed for HIV prevention due to these developments. And I gave a version of this talk with one of my many thought partners, Dwayne Williams of MOBI, which is a group called Mobilizing Our Brothers Initiative. And his portion of the talk is everything must change. And it was based on this idea that because the landscape has changed so much, we have to really take radically different approaches to what it is that we're doing in terms of trying to prevent HIV. So I mentioned PrEP. Well, it's an amazing, wonderful technology, medication, biomedical prevention is what we call it, that can prevent HIV, but it is unfortunately highly underutilized among individuals who could benefit from taking it. And we see these really radical differences by sex gender, with men being significantly more likely, 41% of men who are appropriate for being prescribed PrEP, on PrEP, but only 15% of women. And similarly, we see racial disparities. So in addition to everything changing in terms of HIV prevention, everything has changed for us in terms of communication and technology. When you look at this, you realize these changes have been really, really recent. Obviously, computing has been in development for many, many decades. But the kind of access we have to teeny tiny computers in our pocket and what we can do with those and the kinds of immediate gratification that can give us is actually pretty recent. So just as a little timeline, the car phone, remember that big bricky car phone? Some of you don't. You weren't even born. You weren't even, your parents might not have been born. That came out between 1973 and 83. Smartphones was just the early 90s. Messenger was 2001, the iPhone 2007, and today 97% of US residents own a cell phone. In terms of computing, we moved from digital bulletin boards, which were actually transformative for anyone who was part of that, to social media in the 1990s. Facebook was only launched in 2004, MySpace 2005, Instagram 2010, it's just a decade plus old, and TikTok only 2017. And since then, of course, we've had multiple social movements that have been completely transformed by these technologies as well. In terms of how this technology has affected how we connect for sexual purposes, we now have a number of apps that people can use, again, in their pockets, websites and apps, where you can meet friends, sexual partners, etc. And this increase in the dominance of social media-based interactions, and that opens up the possibility of living multiple lives in these multiple virtual or digital worlds, all at the same time. So I can be sitting here talking to you, and someone might be looking at some pictures of mine and commenting on my feed in one of these different arenas. And there are massive gaps in terms of who is using the technology, with age being obviously one of the biggest drivers. But it is quite prevalent. When we do focus on young people, we see that over 3/4 of them between 18 and 25 are using Snap or Instagram. We've seen massive increases in access of mobile internet through your phone since 2011, and COVID accelerated that development. What's interesting and important about all of these social media platforms, the apps, is that they are psychographically targeted in terms of the content you see. We all know this. You can tell, you can experiment with it. You can linger a little bit on a certain ad and you will get a certain type of ad a few posts down. They know everything about us. And Google knows when there's going to be a flu outbreak. I wager that Meta knows who's going to split up, who's going to get a sexually transmitted infection, and many other things about us in terms of our sexual and romantic relationships. The algorithm, everybody talks about the algorithm. What is so powerful about it is that it's unobtrusive, it's invisible to us. We don't know what it is, but it self-corrects and it's adaptive. And it happens in real time. I'm sure you've had the experience. It's quite shocking sometimes. But young people in particular live large portions of their lives on these apps. And there has been the emergence, as we know, of influencers. Influencers are incredibly important. When we used to say peer opinion leaders or opinion leaders, That's what an influencer is. That's all an influencer is. It's not anything different than that. And it's very important that if we are going to move into this sort of modern evaluation world, that we recognize the role of influencers, we respect it, we remunerate, we pay for it if we are trying to leverage their power and their influence for HIV prevention. And again, 92% of people 18 to 29 follow influencers, and many of them, not the majority, but the plurality or a plurality, really trust influencers over a brand. They are seen as regular people, even if they do product endorsements and they are ambassadors, they are trusted. The other thing that's really important to note about how we're using technology, particularly the apps, is the role of YouTube and videos. We now have videos that can teach us how to do anything. And the role of video as a, video mediated communication and interaction and sexual interaction is really important to our future as well. So, more context. So what is capturing young people's or people who are highly involved in social media? What is capturing their attention? Well, there's a look, there are visuals, there is a certain aesthetic that is developed for all of the different platforms, for different influencers. And this is what people expect and what grabs their attention. So it's highly entertaining, it's visually very exciting. You have commercial and popular media. Euphoria, it's an old show now. People are probably like, oh, Euphoria, that's out of date. It cost $11 million per episode to produce Euphoria. So you have amateurs and semi-professional content creators, though, who are going for the same production value as that kind of commercial media. And they are often extremely successful with this. This is a picture of a trans femme model, Jari Jones, and she was, nominated at the Cannes Film Festival for her film, and she is really, a very powerful influencer in that world, and this is her Instagram handle if you want to look her up. In terms of the kind of influence they have, a mega influencer has as many as 1 million or more followers. They can make up to $180,000 a year using their platforms, and less sort of lower tier influencers have anywhere from hundreds to thousands to tens of thousands of followers. This influence follows many of the social influence processes and theories that we as social scientists are familiar with. The normative social influence, where we feel like we want to comply with either the attitude or the behavior that's being displayed through the behavior of the influencer. We may identify with the influencer or the person that we're seeing, whether they're an influencer or not. And then, of course, we can internalize those attitudes through contact with their content. Social comparison as a negative product of social media has been focused on quite a bit. This has been focused on in terms of Instagram's power over young women, and that it's, the negativity that can have, the adverse impact that can have on young women's mental health. Social contagion, we've seen that in terms of these challenges where people see a certain challenge and everybody tries to emulate it, and then that spreads through our virtual networks. Sexual socialization, where we learn about what a certain identity, what is normative for that identity in terms of a sexual or gender identity. Sometimes we can acquire certain sexual skills. Again, this is very important in terms of where you probably know some of this is going. And we can develop certain sexual attitudes or predispositions in terms of how to behave. And then, of course, the subjective norms, what other people are thinking and how important that is. So what this means is that we have the potential, as I said, to be living in this multiverse. We're operating, we're creating identities, we're presenting ourselves to the world, we're doing impression, right? Goffman's impression management. We're constantly trying to manage that in these different fora. And many people will sort of criticize this. They will say, oh, that's inauthentic. You're not a single person. But anyone who is familiar with internal family systems or various, parts of us, and anyone who is a code switcher or who has had to navigate different worlds IRL in real life knows this is an essential skill to survival as a human, and that what these spaces offer are chances to, just as I said, adopt new attitudes, develop skills, try on new sets of clothing, try on new identities. Sometimes the worlds overlap, and sometimes that's okay. Sometimes they collide, and that's not okay. You do not necessarily want your Grindr profile, your Field profile, or your FetLife profile to interact with your professional LinkedIn community. This could be a problem. And so we have the potential to really separate these worlds, develop these different identities, and our developmental timelines may be different on all of them. And so this is what I mean about the multiverse. It's probably not as exciting as some people might think. It has less to do with Marvel and much more to do with these virtual spaces. But it has tremendous potential for us in terms of spaces for intervention. And so how has all of this affected sex and how we have sex? Again, the primacy of imagery and videos. Anyone who has studied anything about pornography knows, that the pornography is ancient, but it is also has become much more accessible. But it was only in 2023 that Grubbs and colleagues published in American Journal of Public Health an opinion piece basically calling for porn to be treated as a public health issue, not a problem or concern, but just to be studied. They noted, I believe, in their article that there had been no study published on porn in the American Psychological Association's flagship journal. And I'll have to check and make sure that that's true, but it's really shocking to me. So digitally, video imagery is just incredibly important. And what's happening, people are learning about sex, and there are studies, for example, Carmack and Rodriguez conducted a study with 236 college students and found that using Facebook 3 or more hours a day was associated with sex without a condom, and using Facebook to pursue hookups, which is a little tautological because that's probably why you're on Facebook. But it was associated with sex without a condom. Women who were on Facebook 3 or more hours a day were less likely to have sex without a condom, but more likely to have concurrent partners. So they were using it for concurrent partnering, which is where you have multiple overlapping partners. Men who used Facebook the same amount were more likely to pursue those Facebook hookups. And then there was another study by Young and colleagues in 2022, and they found that there are associations between HIV risk indicators and Facebook features. So they found that in terms of the likelihood of having condomless sex, including communication about sexual health, ballroom culture, and friendship centrality in Facebook communications was associated with condomless sex. It was higher for communication about sexual health. It was communicating about ballroom culture was protective, and friendship centrality was protective. And this was a very interesting study that looked at networks on Facebook. So what else? They have findings also on chemsex and PrEP use, which are very interesting. But again, that study just came out in 2022. So we're really behind in understanding how our communications, the content of it, the network structure of it affects how we behave sexually. So in addition to the primacy of video, we have digitally mediated sex. This can create safer sex work, sex positivity and body positivity. So with these multiple universes, we have spaces where people who have been excluded from mainstream norms, conventional norms, whether it's Western beauty or other things, have a space and more positivity around non-mainstream body types, sexualities, gender identity, and all sorts of things can be promoted. What we also know, though, is that there, as all sexual activity and partnering is, there are marketplaces. There are more, though, diverse marketplaces. So the question really is, how do we maximize pleasure and reduce harm? And just to show, this is a graph indicating increase in users of OnlyFans, Patreon, Twitch, and other Cameo, other digitally mediated video-based platforms where a lot of sexual activity happens. And you can see since about 2019, OnlyFans increased dramatically. It is a significantly safer way to engage in sex work. However, what happens next is a big question, right? Do we have the tools in order to support people who are accessing sexual content through these platforms to transition to in real life activities that may be idealized, may not be instruction on how to do them safely, may not with consent, may not necessarily be displayed in the video or the content that is consumed on these platforms. And so we really need to consider this and work on this a little more intensively in terms of HIV prevention, consider how young people are exposed to the content increasingly, and how this integration of the mainstreaming of some of the sexual activities that happen on some of these sites into, what is called vanilla sex. That needs to be addressed, and we need many more interventions to address that. So this multiverse is real, it's already happening. And we in HIV prevention science are really just trying to catch up. And just to provide a contrast, this is in contrast to what we've done traditionally. So we have decades of HIV prevention interventions under our belt. The social intervention group and I myself have contributed numbers of HIV prevention interventions to the evidence-based compendium that the CDC manages that have been demonstrated to reduce HIV sexual quote-unquote risk behaviors, whether it's condomless sex, anal sex, etc. However, with PrEP, everything has changed. So, our focus is very much on uptake of PrEP in the future. But most of these interventions have been face-to-face and in real life. Often they're healthcare system based. Sometimes they're tech mediated, but not often. And if they are, it can be clunky. Sometimes it's just text-based. Sometimes it's just watching a few videos. But it is not typically like the experience, the lived experience of being online and then transitioning that online learning into real life. It's not on demand, and it's usually not entirely virtual. It uses typical, content and theories that we would continue to use, particularly, obviously, the social influence theories in a new world of e-health, entirely, electronic, digital, or virtual health interventions. So what do people want? So when you talk to people about the kinds of interventions that they want, and when you think about what folks who might benefit from biomedical HIV prevention want, we see that we want what everybody wants. We want to be seen, heard, and understood. There needs to be trust and respect so that our humanity is recognized. And primarily, people are having sex. People have sex for all sorts of reasons, and they're all legitimate, right? If your goal in having sex is to earn a living, you want to be able to do that in as productive and safe a way as possible. If your goal in having sex is to have connection, you want that to achieve connection. If your goal is sexual pleasure, and of course these goals are multiple and overlapping, You want the sexual pleasure needs to be met. So you want to feel good, joy, desire, or whatever other emotions you are seeking. You may want to be connected and to have trust. But in this new world, much of that, or your ability to pursue that, is really just a click away. And so we have to meet people where they're at, which is really a central aspect of social work, meeting folks where they're at. The other thing is that people expect now things to be tailored. They expect, because of interactions with social media, they expect that what you offer them is going to actually take their unique situation into account. And again, they want it fast. So as an example, I have some pictures here of a really fantastic company called B Condoms. It's a Black-owned condom company. They have incredible content on Instagram. And as soon as DoxyPep and DoxyPrep came out, they began offering it on a commercial level. Okay, so, but what still, all of this talk about social media, it still doesn't deal with the barriers. You know, what it does let you do is you can go into some of these spaces that are going to be much more accepting. Everybody is doing whatever it is you like to do. Everybody identifies in the way that you identify. But getting into all of those communities separately is very challenging. In the past, when we did a community level intervention, it was very much boots on the ground in a neighborhood, in a physical geographic community. And they are very important because community norms and community level influences are really important in terms of HIV prevention. That we learn about sex from our communities and porn. We learn about what is acceptable in terms of partnerships, in terms of social interactions from our communities. And so, you know, traditionally, much of this has been about community empowerment, mobilization. It's mostly been face-to-face. Again, it's been using the same social science-based theories of how we influence each other. However, because everything has changed, and because we have this potential to be everything, you know, everywhere all at once, we really need to adapt those approaches to these virtual spaces. So as a quick example of some of the things that we've done in the past, my colleagues and I worked on an NIAID funded study to develop an awareness raising campaign to drive demand for PEP. PEP is post-exposure prophylaxis. PEP is what you take if you've had an exposure to HIV. It's what physicians, healthcare providers take if they've had a needle stick. It's so effective, we don't have efficacy data because there were no efficacy trials. Everybody just started using it in healthcare settings, and it's effective. And so we created a bus shelter ad campaign. Okay, well, I'm sure you see where this is going. We ran a study called Change, which morphed into a study called Charge, which my colleague out there in cyberspace is working on with me. And again, we did bus shelter ad campaigns. The goal of it was to reduce community level HIV stigma and homophobia through a multi-component intervention at the community level, including the bus shelter ad campaign, including street-based trainings, training community-based organizations. And we had a good result. We saw a 350% increase in testing at our community drop-in space. We did all of these face-to-face trainings. We used link Phelan into videos, model for how do we interrupt HIV stigma and homophobia. All of the trainings were very carefully sort of focused on this cycle. We came into contact with hundreds of people. We did multiple trainings from 5 minutes to 2 days. And we would go into barbershops and hair salons. We had a drop-in space that was very small. It wasn't well ventilated. And again, I think you see where this is going. COVID-19 hits. Nobody wants you in their barbershop. Nobody wants you in their nail salon. Nobody wants to pack into a tiny room with 50 other people to eat pizza and to do, you know, arts and arts-based activities or to watch a film and then potentially get COVID. So COVID accelerated the trend that was already there, and here we are. We're living in these different spaces. We have to operate within them. And we face some serious methodological challenges in terms of doing that. We're living in those spaces, but regardless of whether it's virtual or in real life, we have the impact of stigma and discrimination. We have the overlapping multiple identities and communities, and we have the challenge of measuring how people are exposed and what they're exposed to in all of these different universes. So what have we been doing to try to address that? I am going to admit, I'm sure there are scientists out there, data scientists in particular, who are better at, who will tell me how I should be doing this and how we should be doing this. And I look forward to either hearing from them or talking to them. But we have several studies. I'm going to focus on a couple that are based in Kazakhstan, working with women who exchange sex for needed resources. And we've had a heavy use of Instagram in these. We've used Instagram and social media to recruit participants, but also we use memes as a source of an intervention. And so a meme is a term, it was coined in 1976 by Richard Dawkins. And it's this idea that it is like a gene, but it is a meme. It is an infectious cultural element that we can pass along to people. And what's great about memes is that people add their own take on it. So you may get one image that people will take out a few words and add other words. So it's actually socially interactive via digital expression. It is consumed very rapidly. Memes rely on what we call fast thinking. So do stereotyped cognitions. They activate automatic thoughts. So one of the most damaging stereotypes that is propagated almost every night on the news is the association, or actually it's not an association, the false association between mental illness and violence. This is something that is, a fast, automatic, stereotyped thought that is not based in reality, but it is something that is incredibly damaging. So how do we re-engineer and how do we interrupt that automatic thought? And so one of the ways that we tried to do it was through reframing, through memes with women to encourage HIV testing, HIV self-testing in particular, so that the automatic thought, negative internalized HIV or sex worker stigma could be reframed by using self-compassion and noting our shared humanity. And so that's just one small example. We also have Charge, which is, as I said, in R34, it was the child of change. And in Charge, we're really trying to address our need for a more modern approach by partnering with an organization that is incredibly successful in being online in these virtual spaces. So Change, as I noted, was the one where we were boots on the street. We were doing trainings in barbershops and beauty salons where nobody wants us anymore. So we had to adapt to the new context. And so we did that by partnering with Moby. And Moby is an organization that really starts from a critical theory and a pleasure activism space. They center Black queer culture and their entire reason for being, and they are funded through HIV prevention funding. They focus on the incredible professional, artistic, and creative productivity and success of queer Black people. And so what we did in Charge, as I said, we partnered with Moby, and this is just like examples of the kind of imagery and the kind of look that they have. We partnered with them to use a system dynamics modeling approach to create these things called causal loop diagrams, which we attempted to understand what are some of the reciprocal feedback mechanisms in terms of stigmatization that leads to, so stigmatization and discrimination, both by HIV, both in terms of racism, in terms of gender identity, in terms of homophobia, that would prevent people from accessing testing, accessing PrEP. And we came up with what I call spaghetti salad But it was a very intensive process where we did identify several loops. And what resulted was a couple of loops that we focused on that turned into a film. And while I don't think we have time for me to show that film, I will just say that we had two films that were made. One depicted stigmatization within community, within a chosen family, within the gay Black male communities, because again, they're communities, and another focused on healthcare and really focused on the importance of representation, both in terms of gender identity and race ethnicity in competent, and the role of cultural humility in competent interactions in order to increase testing and PrEP uptake. So that was our first step. We ended up piloting the film prior to or during COVID, and we are, by the end of May, going to repilot it or reproduce it using a MOBI production value approach. And hopefully we're going to also be using social marketing and media metrics to evaluate what we call our run up to that event, and also doing as many approaches to, seeing what the impact is on attitudes. So we will be posting, behind the scenes with the, MOBI bill actors, interviews with the producer, little snippets of interesting parts of the film, and then do content analysis of the comments. During the event, we're going to embed flash polls that attempt to evaluate what people think of certain characters, what they think and feel about certain things that are depicted in the films. And so all of these are approaches that we've derived from commercial social media and media marketing and evaluation in an effort to mimic what they're doing. But it is challenging for people who are not in that world and don't have access to all of the tools necessarily. But we are doing our best. So returning to the challenge of these evaluations, one of the things when we do traditional community level interventions, we are hoping that by intervening at the community level, whatever it is that we're trying to do is going to travel along the networks within the community. But so what is effective about that is also one of the threats to it. So you have multiple communities, and often what you'll find is there'll be a randomized cluster community design, and they'll say, well, the communities have to be far away from each other, so there's no contamination. But in the virtual world, contamination is what we want. And it's impossible to actually randomize virtual spaces, right? So what we need is implementation science in these virtual spaces. So we can learn how to evaluate our efforts in these spaces based on what some of the traditional challenges to evaluating community level interventions are. What are the boundaries? We characterizing the multiple universes, spaces, platforms, social media spaces that people are existing on can be challenging. How much exposure do people have and to what content in each of these spaces? For every geographic challenge, there is a virtual space corollary that we can deal with, but we do not necessarily always have the tools or the access. Other important challenges in a traditional community level evaluation effort is this concept of people not knowing what you're doing because you want to evaluate the effect without them having a desire to please you through social desirability reporting. So you often will blind people, especially with, and again, that's probably not something I should say, you will mask what it is that's happening so that you don't have that as an issue. That's much harder in terms of the social media space. Lagged effects, again, this is something that we could look at quite a bit and well in social media and other digital or virtual spaces with the right data. And anyway, so these are some of the issues that we found to be challenges when we were evaluating change. And again, the idea that we have traditionally sort of, unfortunately, often thought of processes as linear, and that has changed over the last 10 or 15 years with multi-level modeling, migrating from sociology much more into public health and social work. But the linearity of it is also still a problem. And again, we have some methods to deal with that, and I'm hoping that data scientists can help. We also have a great challenge of understanding how these systems of oppression are manifesting in digital spaces. Rob Eshman is a colleague here. He studied this quite a bit. There's obvious acts of discrimination, chat, content, but then there's the sort of, de facto, just the segregation within some of these spaces. There's a really good paper that talks about filtering and blocking as being really important to protecting oneself as a person of color in some spaces. So this is another, characterizing the universe of users is not like data that we have access to. And so that can be a great challenge. And, the other challenge, like I said, data access and reporting. People have multiple phones. People who are concerned about not being discovered in some of these spaces will use what they need to use in order to do it safely for themselves. Again, enumerating all the spaces is challenging. But mostly what I struggle with are the analytic methods. How do we do the kinds of studies that are considered to be the most rigorous in cyberspace? RCT is the gold standard, randomized clinical trial, randomized at time and attention controlled trial. This does not work really in cyberspace, and I've seen some really tortured studies try to make it work. Again, stigma and discrimination, it's still there. We don't have good evaluations of stigma and discrimination in geographic space. How are we going to evaluate it in digital and cyberspace? And again, going back to the issue about concerns about who knows about this. A lot of studies will ask a user to install an app on their phone. This is something that many, many people are unwilling to do. Privacy laws are great. They helped a lot. However, they reduced our access to a lot of data that we used to have access to through different scraping methods. So what do I think needs to happen? And it's 5:30, so you guys are probably really tired of hearing me talk. I think, we really need to partner with fast organizations and entities. Institutions are often really too slow. And there's a great nosy notice of special interest that NIMH just released on AI and digital, big data, and that's great, but it's 2023. We needed to have, done that about 5-7 years ago, minimally. I think we need to redefine rigor. We need to have good conversations about new methods to evaluate in real life, in real space. This is something I talked to my colleague, Dr. Kiosha Bond, about quite a bit, and Dr. Duncan, who's at Columbia. They're my MPIs on an R01 that we have together. We need to get out there in real life in these spaces and do those evaluations. We also have to get serious about what people are doing. STIs incidence has gone up significantly since PrEP has hit, and among populations who are not necessarily at risk for HIV. We've seen this among young women in New York City. We've seen it globally. We also have emergent infections, Mpox, et cetera, that are being sexually transmitted now in places where it was endemic and ignored. So so we need to really understand what people are doing sexually and accept it with no judgment. Fluid exchange is a really important part of sex for a lot of people. And just, full stop. Working from that place is where we need to work from. And again, we really need to do what Meta and Google and others are doing. We need to slide into people's DMs and use that technology to reach them. So that's it for me. And thank you for your time and attention.
That was a fantastic talk, and I really appreciate it. And I wanted to start by asking if we could dig in a little deeper on this. What I'm always struck by your work and by our other colleagues in SIG is the deep community engagement. It's really authentic. It is not window dressing, and it's clearly, there you are. It clearly makes a big difference in the work. So I just wondered if you could talk just a little bit more about that. You told us a little bit, but if you could dive in a little more about what makes that real, and what are the pitfalls that we have to avoid if others wanted to, say, follow in your footsteps in doing it like that?
Well, I mean, I think, again, I having or working very closely, partnering with people. So having and partnering in really authentic ways with people with what is, I think, annoyingly called living or lived experience is crucial.
Yeah.
We don't have to be doing all of the things that participants in our studies might be doing, but having some familiarity with it, being, knowing what it feels like, I think is really important. And what that translates into is that you are part of a community. Like, we're all in communities if we're lucky.
Right.
And how have you been on the receiving end of the formal social control system? Has ACS come to your house? Have you been told that your child in a public school who has an IEP is not getting their services? Why? Who knows why? And are you getting out of work every day? Like, everybody who has been subject to these public health, social work interventions knows what that feels like. Anyone who's doing research on this should also, I think, know what that feels like. So I'm not saying every researcher is in the community with people, but we should interrogate our own experience with community, A. B, authentic partnerships with communities. What does that mean? It means your PIs have lived experience, are members of the communities, you are yourself. That this is not hard in this day and age. We have highly trained scientists. There are serious issues with racism and sexism in study section, at review groups, in academia, in terms of tenure and promotion, that minimize the opportunities for individuals from oppressed groups to assume these roles. But you can advocate, you can change that. We all need to change that for ourselves and for our colleagues. So that would be two things: that the partnership is there, and then the resources need to be distributed equitably. I see this very consistently with the SIG work with Gersha in Kazakhstan, on every budget. Also in the US, in terms of charge, we're trying to get Moby as much money as possible. So authentic partnership means valuing someone's time. If you think an influencer should just do their job for you for free for the cause, well, are we working for free for the cause? No. I'm getting paid to do HIV prevention science, so should they. It's not a volunteer activity. So I don't know if that's what you meant, but I think
no. I think it has it's so many multiple aspects, and I think what you're talking about is that it's a real relationship, right?
Absolutely.
And without that, I don't think you can make it work. And I think all the strategies that you're saying, what does that mean? Valuing the time and the expertise and sharing resources is all part of that if it's going to be real, right?
Absolutely. Anyway. And recognizing when Dwayne says everything has to change, you say, you're right. Yeah. You're absolutely right. Everything has to change.
Yeah. Good. Thank you. So I'm going to jump to something somebody just put in the Q&A. Are you or organizations working with influencers to do guerrilla marketing on PrEP and PEP, sex education resources, et cetera?
I mean, we're not, but we do hope to integrate some of those methods in our studies, but that's a great example of the tension between the way we as researchers have to go through ethical review, other types of review that would probably not be super supportive of that approach. Whereas an average person who, is trying to promote their company or their product, they can do that. And that's why I'm saying that what we need is implementation science in the digital space, meaning scientists kind of need to, I think the best work that's happening out there is by influencers and some of the small companies or even large companies that are seeking to influence. Obviously, a lot of the corporate stuff is about consumer behavior, but if it's buying condoms or DoxyPep or DoxyPrep or, are these other, or learning how to use sex toys safely, that's great. That's going to reduce the incidence of herpes. That's going to reduce the incidence of HIV a little bit, So that's an example, a great example of how we can't do what they do necessarily, and certainly not quickly enough.
I see. Yeah.
So, adapting implementation science methods to these digital spaces is absolutely what's needed. And I know there's smarty pants people out there who can help with that.
Not me, yeah. But yes. But no, it's fascinating that, the overlap or the integration, you just referred to it, of, implementation science in the digital space and all the tools through data science, through AI. It's not what people usually think of as social work research, but I think it's very true in our environment here. And I'm just wondering how that impacts you as you join this community. We were so pleased to welcome you on July 1st of this year, and grateful that you're part of our faculty now. And how does that feel to you coming to Columbia? Was that part of the attraction, or what?
I mean, definitely. I imagined that access to the Data Science Institute, and the people like the statistics department being just a few floors down, all of that I thought, would be, and I, hope will also continue to be, useful and transformative. There is a whole world of mental health influencing going on on these platforms. You will see numerous therapists, couples therapists, sex and relationship therapists. There is a whole world of the void and not stepping into the void, avoiding the void. I'm struggling with the void. There's tremendous potential, I think, for social work to understand what people are learning through these spaces. I mean, we do know about social contagion of suicide and suicide attempts. Right. And we also know that it is heavily weighted towards digital spaces. So I think there's a lot more work that social work can do in these spaces by meeting people where they're at. A lot of the work I see, like I said, in terms of HIV prevention, it's very high quality. There is emerging research, though, that non-targeted depression interventions increased self-reporting of psychological distress among young people. It was a study done in a school setting. Wow. And so the science does need to weigh in on who's going to be best served by the content and what are some of the unintended negative consequences of the content. And how do we message that? How do we educate people on the potential danger of very young people in critical periods pairing certain stimuli together? Sex and violence is the obvious one. I'll be very frank, if you're talking to your kids about porn and they're out there looking at it, making sure that you're not looking at, for your first formative sexual experiences that cause arousal, pairing violence and sex is very important. Mm-hmm. How do we message that to parents? How do we message that to young people? I don't think there's necessarily, that may be being done. Again, this is not really, that's not really my area of expertise, but I think that's very important. And for mental health, the same. So that to me is where I see social work also having an opportunity to really dive in here, possibly more.
Yeah, yeah, that would be fascinating. Someone else has entered a question, and it's about the influencers and how are influencers useful when it comes to vulnerable populations, for example, incarcerated individuals who are at greater risk of HIV compared to those who are not incarcerated. And how does that work? And how does the add-on question to it is, how is cultural competency upheld?
Yeah, that's a great question. I am not familiar with the influencer world in terms of people who are either currently or formerly or affected by, the mass incarceration or incarceration in this country. I know it exists. I don't have to see it to know that it exists. And I could also see tremendous potential of those spaces helping with transition, in terms of, what kind of access, again, around sexual behavior, what kind of access to content did you have? And what is that going to look like during a transition out of a carceral setting? So I don't think that's really answering the question, but I think it's a great question. And I don't want to say it's not happening. I'm sure it is happening, but that's another space. The Justice Lab could be doing that for all I know. And I think that's a really important question. And then what was the second part of the question?
It was about cultural competency with influencers.
Well,
right?
the good thing about influencers is they don't gain an audience if they're not competent. Like people just don't follow you.
Right.
If you don't speak to your audience, they don't follow you. So going back to the sort of three parts of sexual socialization and even social influence is the identification process.
Right.
There's some part of you as an influencer that people identify with. It may not be your whole self, but it's the parts, right? And again, whether we're thinking about multiple selves or social identity theory or parts like internal family system, this idea of different parts. And again, that's a real simplification and someone's like, oh, that's an Instagram psychology take. You're not wrong, but like some part of you has to identify with the influencer, and enough people do, then and yes, they do misstep, of course. And this is where you see a lot of, you see this online now, right? Cancel, like being canceled, or you have to apologize, and people do rebound.
Right. Another question that was submitted ahead of time, actually. It says that Albert Musher had a deep belief in the power of science and technology to improve the human condition. What are your thoughts on how well-being and quality of life can be improved through science, and specifically social work principles and practices?
Wow. Well, to emphasize the science and technology, I've made it clear, for whether you like it or not, this is how many people are living. And as we go on, if we're so lucky to, it will just be the majority of people who are spending significant portions of their lives online, on social media, living through apps. And it is a space where the data is there. It's a matter of reclaiming it as a public. And this is, I think, a policy issue that social workers can have a really important influence on as social policy analysts. We have to push back against ceding all of this data to these private entities. We are giving it freely, but how much agency is there when you don't have many choices? There is no alternative to Facebook or Instagram until the next one comes out. There is no public Facebook or Instagram. Would we want that? I don't know. But having access to that data, because it's a public good, I think is a policy position that social workers could potentially take. Again, the principle of social work of meeting people where they're at.
Yeah.
And recognizing our shared humanity. These are guiding principles for all of us, I know.
Mm-hmm.
And this is where I think these spaces have really helped us. It is transformative for someone who has felt excluded, marginalized, stigmatized, despised, vilified, to find community online. It is completely transformative. And so this is what these spaces are. Now, there's downsides and there's things they are, they're not clinical social workers. But how can social work support that? How can social work advance it in a way that is consistent with the values of social work? Because there's a lot of really awful things happening online. And there's a lot of danger happening online as well. For all of the great things I'm talking about, there's tremendous amount of victimization, misinformation, digitally manipulated photos that no one could tell the difference of. The lists go on and on. So that's, I don't want to emphasize the negative. I think one of the things that I hope this talk has communicated is that we have to celebrate the beauty and the positivity and the joy, the cultural accomplishments of people in order to for them to want to be with us. We can't just constantly be like, even in starting this talk with a few slides on racism, sexism, homophobia, HIV stigma, I was like, oh, there's, there we go, deficit framing issues again. That's the reality. That's why we have the situation we have today. These are the systems that produce the disparities in our country. We know that. So we have to start there and acknowledge it. But what is the solution? It's not more of that.
Mm-hmm. Yeah. I was just thinking about those initial slides, because when you got to the end, you were talking about STIs going way up, not just in the US, but globally, I think you said. And I'm wondering how that interdigitates with the the structural and systemic inequities that drive a lot of this.
Right. Well, we know Mpox has been ignored completely in the countries where it was endemic, and we continue to have some outbreaks here, as we know, but there is advocacy to focus vaccine efforts in the areas where it was endemic and where there's, as I said, evidence of it becoming sexually transmitted. It's highly stigmatized. Mm-hmm. That's going to intersect, obviously, with systems of, the gender system, sexism in these areas, as well as homophobic that's endemic. Mm-hmm. So, that's one example. Travel. I mean, we have COVID. We know what can happen as these viruses jump and then are transmitted through plane travel. So, and the other thing is we're really, we need to understand that some of the infections are, skin to skin. And so for HIV prevention scientists, we've really also, only focused on HIV, which, as we know, is only transmitted through certain body fluids. But, if we move into trying to emphasize STIs, that are skin to skin, we're going to have a different set of, everything's going to be different.
Yeah. Thank you, Victoria. So two other questions have come in, and we're going to be wrapping up soon. So if you have another question, please enter it into the Q&A. But let me ask these. Someone asks, what would structural interventions look like in the digital multiverse?
That is a great question. And I would say some of it is, would be a policy where they could be policies, and we've seen policy implementation that have actually hurt vulnerable populations. So we've seen, and I read a whole book called Porn Work, and it was about sex workers on video, on cam, and in real life, and closing down of certain spaces where they did their trade led to significant vulnerability for them as a group. And they warned the legislatures that did this ahead of time, and they were ignored. So there is a tension between protecting children and the rights and health and safety of sex workers in that instance.
Right.
I would have to open the book and get the exact sort of verse and chapter to tell you what it was, but that's an example.
Yeah.
That was a structural intervention that increased harm. So, a positive structural one would be policies that center the safety and welfare of sex workers, people who engage in sex exchange for resources. And I see this other question, and I really do want to answer it.
Yeah, we should get to that.
No, and
so it's thanking you for your acknowledgement of privilege. And I'm curious to know, how are you using your privilege to support people who are disproportionately affected without causing harm to the selected population?
Well, first I'll say I don't know that I'm not causing harm. I try to minimize that I know, but that I always acknowledge that the potential is there, and I'm trying to scan for ways that it can be harmful. One of the things that I usually do when I give a big talk is I try to make sure that it's not just me talking, because none of these thoughts are all mine. This format is, we know, a reflection of white supremacy. It's privileging one person as if they invented everything. It's a fallback to a very exploitative bench science model. That's really not how science works anymore, and it's not how social science works anymore. It's a cast of thousands, and having one person up representing it is that's not how it goes. So usually I would try to present with someone else, and I should have insisted, actually. I didn't even think of but that's like, there's my racism is showing, my sexism is showing, my everything is showing. I was like, oh, okay, I'm going to do this talk, and then I start preparing. I'm like, oh wow, so much of this is like the product of collaborations. It feels bad, actually, sometimes, to present this way. So I think we should really be changing. Like, that would be a way to change the privilege is to change how that is done, would be that. And talking about collaborators, that it is a group, it's like a joint production. And so I take that to heart, and I will double down on sort of that approach. But, and I do try to listen to my colleagues who are not similarly situated. And I acknowledge I'm socialized to that position. And just, I know acknowledging it doesn't change it, and it doesn't make it not have its impact.
Right. Thank you for your thoughtful response. I think we're just about ready to wrap up. It was a beautiful talk, and your work is so impressive and so important. And to you and the entire team the multiple teams that are working with you in the multiverse to reduce risk and to improve well-being. It's really impressive. So everybody, please join me in thanking Dr. Frye, and best of luck going forward.
Thank you. Thanks for this opportunity.
Sure.
And thanks to the Mushers for their support.
Excellent. Thanks. Good night, everyone.